All right, it is time for Ask the Derm. Board certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your skin questions. Let's get to it, shall we?
Sure.
All right, our first question says, hi Dr. Groff, I work as a real estate agent and I can't control the sweating on my palms. It's horrible and embarrassing because I have to shake a lot of hands. Can you help me? This is Bobby from Chula Vista, and we do have a picture to kind of demonstrate what we're talking about. Wow, these really are sweaty hands right here.
Wow, that's pretty impressive. And you know, there's different medications you can take by mouth, but they don't really seem to work very well, and they have a lot of side effects. They'll make you tired, so patients generally don't like to take those. We also have some things we can use topically, but again, they don't seem to work very well, and they're messy. So really the best thing for sweaty palms is Botox,
I knew you were going to say that.
Yeah.
How did I know that? Because I've heard of people getting it in their armpits for sweating there.
Exactly. So we can use it on the palms, we can use it in the underarms, we can use it for sweaty feet. So it's excellent. It really shuts down, like I'd say 90 to 95% of the sweating. And it lasts like about 6 months, so it's a good deal.
Generally speaking, how many injections do you need to get?
Well, we use a really, really tiny needle, so let's say probably maybe 15 or so, but we use numbing cream, and so you don't really feel it.
Does insurance sometimes pay for that?
Sometimes they will.
It just depends.
Yeah, it just depends on your insurance.
All right, let's get to our next question. My husband and I just went to Cozumel. Look good for you. And I broke out in a stinging, itchy rash under my bathing suit. What could have caused this? This is Cheryl from Cardiff, and we do have a picture of this one to show what we're talking about here.
So do you know the answer to this one too, or?
Botox.
No, not for this one. Now this one's actually a really interesting case. In the warmer ocean temperatures, there's a jellyfish called the thimble jellyfish. It's tiny like a thimble. And when it has babies, these baby jellyfish have these stingers called dermatocysts.
This is it right here, huh?
Yeah, that's the full grown one. But when it has babies, they're much smaller, almost microscopic. And when they get trapped under your bathing suit, it irritates them and they set off their stingers. You get this rash, this really itchy, almost painful rash underneath your swimsuit or your wetsuit. And so it's very uncomfortable. But once it happens, you can use things like topical steroids like hydrocortisone, maybe an anti-inflammatory or like an antihistamine, and that can help relieve the symptoms.
Gotcha, I've never heard of that.
It's called sea bather's eruption.
Sea bather's eruption, I've never heard of that, interesting. Okay, so let's get to our next question. With the beautiful weather, I've started wearing shorts, but I have these nasty leg veins. I tried saline injections, but they hurt and it didn't help much. Is there something better? Juliet from Lakeside wants to know. This is a common problem, especially as ladies get older.
True, and maybe 15, 20 years ago, saline was one of the few things we really had to inject, but saline's no longer considered the best agent for treating leg veins, particularly because A, it hurts, and B, it doesn't work very well. With saline, usually you have to do like 5 or 6 treatments. We have this newer product called Sotradecol, and there's also one called Polydocanol. And it's actually, you can see it's a liquid, but what we do before we inject it is we foam it up, and I don't know if you can see I generate this white foam, and then I attach a tiny needle onto this syringe and I can push it. The needle is very small actually. I can show you right here. You can barely probably see it, but and then we can inject into the veins and the vessels go away, usually with one treatment.
And that's less painful because the needle's smaller?
And the solution doesn't sting or burn at all.
Okay.
So there's no burning or stinging, and you barely even feel it. It works extremely well. Usually 1, maybe 2 treatments is all that's needed.
Really?
Yeah.
Forever?
Forever. Good news, yes.
That's good. All right, let's show, we have a couple of before and after pictures. What are we talking about price-wise?
Well, it depends. It could be anywhere from a couple $100s up to maybe $800 per leg if you had an extensive network of vessels.
Gotcha. All right, let's get to our next question. I love to take my dog to the beach, and I sometimes slip off my sandals to play in the waves with them. I recently got this weird itchy rash on my foot. Do you think it's from the beach? Wendy from Ocean Beach, and we have a picture to show the rash. What in the world's going on here?
These are great questions because summertime's here and everyone's going to the beach. This is a very interesting rash. You can see it looks almost snake-like or serpiginous. It's a very interesting pattern. This is consistent with what we call cutaneous larva migrans. And what this is from when you go to a beach and you take off your shoes, particularly at a dog beach where they've been going to the bathroom on the sand, dogs have hookworms in their stomach. And so when they go to the bathroom, these hookworms end up in the sand. And if you step on them, they can crawl up into your foot and start crawling along your skin.
Are you kidding me? That was a worm
That
we're
was a
looking at?
worm underneath the skin of that patient. You can see there's a picture of what the
no
worm looks
way.
like.
This is
Now,
it.
That picture on the left is a close-up of the worm's mouth. I mean, if that doesn't scare you, so
I'm gonna have nightmares.
when you go to Dog Beach, wear sandals. Do not go barefoot, or that scary guy will end up on the bottom of your foot.
And can it go up in the feet of or the paws of the dog as well?
Dogs,
and affect them or not
their
so
paws
much?
are much more resistant. The bottoms of our feet are much more susceptible to this. so,
Okay.
yeah.
That is really disgusting.
Yeah. I thought you liked that one.
Okay, good one. That was a good one. You got me there. I hadn't seen that one before. We've got
Right.
another question. I've got these things that look like blood moles on my body. What are they and how can I get rid of them? Leanne from Coronado, and we also have a picture of what we're talking about right here. What's this?
Yeah, these little red growths, they're usually about the size of maybe 1 to 3 millimeters. They look like little cherries on the skin, and that's why we call them cherry angiomas.
Okay.
So it's just a dilated blood vessel on the surface of the skin. The good news is these are very easy to get rid of. We have a laser that with one pulse on each one, they're gone.
Can we show
For
the
good.
before and after pictures?
Yeah.
One little pulse.
Yeah, one little, and you don't even need numbing cream. The laser doesn't hurt. Now, if we get a close-up, you can see where we circled all the red spots on this woman's back, and then
Yeah.
I treated her, and you can see the results on the right there.
Okay. And then
So-
how long are those results going to last?
Forever.
Forever.
Once I shoot one of those red spots with a laser, they're going for good.
What
Now,
do
you
you-
may get more over time, and you tend to get these when you get into your 30s and 40s, so they're kind of a marker of getting older.
Maturity.
Yes, maturity. There you go.
It's a marker of experience.
That's
there
right.
That's
better.
What are we looking at price-wise usually for something like
Anywhere
that?
again from maybe at the low end 150 up to several hundred if you have like a bunch of them.
Yeah. Dr. Groff, thank you. I learned a lot today. That was good
Good.
stuff.
Thanks.
Can we get that? Can we get that predator picture up once again in just a second? That was really
good one.
freaky. To get in touch with Dr. Groff, the information we'll put it up on your screen. We've actually also linked it to our website, Dr. William Groff, Cosmetic Laser Dermatology, located on Genesee Ave in La Jolla. The phone number is up there.
There it is.
Raul, look at that thing. It looks like a predator.
I'm on your foot. There I go. Tickle, tickle.